From the heart of New York City, on Fifth Avenue at Trump Plaza, it's Bryant Gumbel and Jane Clayson. This is The Early Show on CBS.
This morning on Health Watch, we're looking at Cushing's disease, a rare disease that causes sufferers to gain excessive amounts of weight. Worse yet, no amount of dieting or exercise can slow the bodies of those who are suffering from ballooning out of control. National correspondent Hattie Kaufman's in Los Angeles with one woman's story. Hattie, good morning.
Good morning, Bryant. Her name is Camille Kimball, and it turns out she has a treatable illness, Cushing's disease. The trouble is, most doctors know nothing about this illness. In fact, one doctor after another told Camille, go on a diet.
I had been a normal weight all my life and had never been on a diet of any kind.
Camille's trim figure is evident in her wedding photos. And for her television career in Phoenix, appearance counts.
Hello, I'm Camille Kimball.
But then, one day,
I put on some jeans to go meet somebody, and I went, man, these are tight.
This is Camille today. So your body dramatically changed in, what, a year?
Yeah.
The weight gain is not her only problem.
You get sick a lot, constantly fighting off throat infections, kidney infections, unexplained fevers. You feel stupid. You feel like you're losing IQ points by the day.
And her career?
Career.
Oh. So she began her search for an answer.
I had what I felt was a nightmare experience trying to get a positive, correct diagnosis.
There's doctors that have experience in diseases like this, and there's doctors that don't.
Finally, Dr. Ted Friedman, an endocrinologist, made the diagnosis, Cushing's disease. While many doctors might see this patient as simply obese, a specialist looking carefully can pick out the telltale signs of Cushing's.
The bruising, stretch marks, the thinning extremities with the gain in the weight in their abdomen. There's a hump back here called a buffalo hump.
The doctor says, go on a diet, exercise.
Yeah. You shouldn't blame the patient. You need to listen to your patient and think about it and try to do as much as you can to help the patient, not just dismiss it.
Cushing's disease is caused by a tumor of the pituitary gland. An MRI showed a small shadow on Camille's pituitary, enough to convince surgeon Harar Shahinian to operate.
We use the nostril, and we do it all through the nostril. It's sort of like looking for a needle in a haystack. You have to really go in very carefully, very meticulously, and try to find the lesion.
When the surgery is successful, the results can be dramatic.
I have had some of these patients with Cushing's. You know, they would come here, they're obese, and they come in and they have their surgery. And they come back 2 years later, and I do not recognize them.
Just one day after surgery.
I feel fantastic.
Do you have any bitterness in thinking this could have been done 3 years ago?
Yeah, it's awful to have so much of your life taken away. And it didn't have to be that way. And to have to fight so hard to get any kind of help. Shouldn't have to go through that.
It'll be months before Camille learns whether the surgery was successful, and maybe more than a year before she's back to her regular weight and energy level. Bryant?
Hattie, what are the chances she'll make a full recovery?
Well, her doctors are optimistic, but they say sometimes, even after removing this tumor, another one can grow back in a few years, so they'll have to keep watching her. And Cushing's can be fatal, so you really have to watch it.
What a terrible disease. First I've ever heard of it, I confess. All right, Hattie, thanks so very much. Appreciate it.
Sure.